Cosmetic dentistry has allowed us to take the profession to a whole nother space where it's about changing people's lives. The worst thing you can do is deliver a smile to a patient and they're surprised by what they see. That should not happen. You should be delivering a smile that they know they're getting already. The flow that we have, we call it the dental triad, right? There's the patient, there's the doctor, clinician, and then there's a lab. Patient comes to us, I spend some time with that patient, get to know them, like I said, we come up with some goals, and then I spend a fair amount of time doing what we call two-dimensional design. Then I send that information to the lab, they convert that to three-dimensional design, and then it comes back to the patient and gets put in the mouth, whether it's a transitional placement in the mouth in the way of temporaries or a test drive smile, or it's the permanent restorations. That's sort of the flow, is basically from the patient to me to the lab back to the patient. And all that has to come together, and communication has to be really clear about what we're trying to achieve to make that happen. We know where we're going. We've gotten approval from the patient's ready, they're excited. They've been wearing a transitional smile or a provisional smile, just like the one we're going to deliver. It's just not in ceramic, so once we deliver it in ceramic, it just puts the icing on the cake. Cosmetic dentistry has allowed us to take the profession to a whole nother space where it's about just building smiles and making people happy, changing people's lives, and it's really overwhelming. The rewards and results are, can't put a price on it, really.